Good morning, folks. It is 11:03 a.m. Today is January 19th, 2024. This is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. As usual, we will go through and introduce our staff that we have from our community services department and our managers, and then we will get into our agenda for today. I will say good morning. I see Michelle Duchesne in the window right next to me. So our community services manager, Michelle, good morning. I see our quality assurance and compliance manager, Scott Barr, is on as well. Good morning, Scott. And our manager, Helen, is on. Good morning, Helen. And I think I saw Jordan on there too. She's going to be jumping between meetings, I think, this morning. Let's see, from community services, I see Beverly this morning. Good morning. And Carly and Shauna. And I see Marty. And I see our training manager, Herman, on this morning. Good morning. And I see Christine on from community services and Heather and my assistant, Zach. Good morning. And let's see, I see Alicia and Tom and Kylie and Gary and Christy as well. We got a full house of community services specialists today. Let's see who we got on here. I see Rihanna on there. Good morning. And Rhonda. We're going to share, folks, today our good news about our approved CPP plan from the Department of Developmental Services. Got a lot of what we asked for. Our director of intake and clinical services, Camelia, is on. Good morning. And our always very busy Adriana is on, always pumping out new vendorizations. Good morning, Adriana. And I see Christina from residential management this morning. Good morning, Christina. And then Sydney and Belinda from community services. And I see Ethan from community services and our client services manager, Wyatt, as well. Let's see, I got Reva from client advocacy on, and then we got Shamir on, our cultural diversity specialist. So good morning to everyone that has joined us. We'll have a few more folks that join us during the course of our meeting today. For today, we're going to give a little updates on some accounting stuff. We always meet with Robin LeMay in the morning, so we've got updates on ARM rates if we've got any residential providers on here. We are going to give an update on our approved CPP CRDP plan. And I know Heather has been prompted that she might need to help me out if I have any challenges with these projects, but I see Christy's on here too, so I could always call on her as well to help out. Let's see, GSP stipend update from Michelle Duchesne. We are going to talk about the ILS rate increases. Let's see, HCBS monitoring from Scott, get an update from him. We've got some things coming up on DDS's calendar. We've got some upcoming things for Alta's calendar and a CIE information from Carly. And then we also have some upcoming events, Carly, that maybe you can talk about as well. I know we have a vendor fair, obviously, the Adult and Employment Vendor Forum, excuse me, coming up, but we have our job fair too. So let me actually, if I don't mind, let me throw it over to Carly first. So let me try to share these CIE numbers for folks. And I will share my screen. Hopefully this works okay. Carly, are you seeing your report there? You're muted.
Sorry. Yes. Yes. So this is the most recent fiscal year report from Department of Developmental Services. This is the full fiscal year 22-23 report. The last one we shared contained data through March of 2023. This contains data through end of June of 2023. As you can see here, ACRC is the top, and we had 202 clients in CIE during the 22-23 fiscal year. That is up from 137 the previous fiscal year. And as you can see, we continue to be in the lead of all the all the other regional centers. We have continued to see an upward increase from all the other previous years. So just want to shout out to all of our wonderful employment service providers. They're the ones who made this happen. So just, yeah. Great job.
And that is why I wanted to share this, and this is what I sent off to our executive director as well when we get things like this. But Like, you providers are amazing. Like, look at the growth, the steady growth that has gone on and the number of consumers that we've had participating. That means, like, even when COVID sucked and everything else happened, you guys still continued to like offer this. We continue to be able to expand the services. And like, no one else had that. No one else has continued to just have that steady growth and then this explosive growth. And I know that we put a lot of emphasis on employment services. It's a huge thing for Lori. Like, she wants to ensure that we are absolutely employment first on everything. And you saw it be part of our strategic plan for our board of directors. And obviously, we certainly give Carly a lot of opportunities to promote it through here and then, some of our other activities. But at the end of the day, you guys are the ones that are providing these opportunities to our clients. And this is just, I keep getting these metrics sent to me by the state about, and I'll share some more of them during this meeting today too, about just our providers and the extent to which you guys are doing all the things that we hope that providers will do to participate in these types of activities, to really expand services for our clients in demonstrable ways. A lot of the things that providers do are really hard to demonstrate, but this really shows that you all as a community of providers, because this is broken up into how many different agencies, Carly?
Sorry,
Would you
how many?
guess? Yeah,
Oh,
like how many different
yeah.
agencies would you guess are supporting the 202 clients?
God, I don't even know. At least 20.
That's what I'm kind of driving at here, is that we have so many different ones of you that are doing this service as well and expanding these opportunities for clients. And all I hear is about people wanting to do more of it. So I just thank you very much to all of you providers, from all of us at the Regional Center, because this is so needed and a great testament to what you've been doing. Carly, I'm gonna jump over, if I can, to the DSP Collaborative website real quickly and see if we can just talk about our job fairs that we do. And I'm gonna share and you can talk about kind of what we have upcoming in the month of April, right?
Yeah, absolutely.
And I will say I did give folks a little preview about this last time, but always good to a reminder for folks, especially since we're going to be working on getting a flyer together for people to register, right?
Yep. That should be forthcoming in the next week or so.
All right, so what have we got coming up?
All right, so April 23rd at the Sutter One Stop out in Yuba City, we're going to be having our next DICE event. Super excited about this collaboration with them. It's going to be at their Boyd Hall. It's their conference, or not their conference, their, what do you call it? Event space right next to their location. And we have space for probably about 30 to 40 providers. They're going to be sharing it as well with all of the people that they support. And so it should be a great turnout. As stated, a flyer to sign up should be forthcoming within the next week or so. Again, that's April 23rd. It will be from 10 a.m. to 2 p.m.
Harley, when we
Additionally,
get
we
that,
did send us. Oh, sorry. Go ahead, Herman, please.
sorry, when we get that flyer, can we make sure we have Thalia post it on our calendar of events and blast it out?
Absolutely.
Thanks.
Yeah, and then additionally, I was showing the DSP Collaborative website. Right now, we're promoting the Early Start Job Fair, and so we want to get as many people drawn to that event as possible. That's going to be coming up on February 23rd. Again, just our commitment to try to support you as service providers and getting more staff. And so, there was a question about should the flyer be translated. In the past, when we've done these at the Employment One Stops, we've been able to have live interpreters that have been brought on board. Let's talk, Carly, and find out what arrangements we might be able to make that are kind of somewhat similar to what we did at the Lemon Hill event. And if so, then we need to make sure that we um, have multilingual actually flyers for the events like we've
Yeah.
done in the past. So that is one that we really, again, we have had the event now. We did that one on Lemon Hill in South Sacramento, which was really well attended right there at that one stop. We had the one over at Sierra College, which was not, I don't think, quite as well attended. There was a lot of foot traffic that I had some people tell me that they preferred Lemon Hill, and then I had other vendors tell me that they preferred the one over at Sierra College and that they felt like they had more luck over there. So I know that Carly has put out a survey for the Sierra College one, right? And we're hoping that providers will get their responses back to us about hires that have resulted from that. Have we put that out yet, Carly?
I think Zach was waiting for you to approve the survey.
It's approved right now. Make it so. Let's get it out. So we need to get that data back. Thank you. And then hopefully we'll have that in the next couple weeks here as we are continuing to move forward with promoting these types of activities. As I mentioned, we did have those in those different areas. So, but now we are looking at bringing it to the, Sutter Yuba area, which is just such a growing area for us. And while we were there, we talked to a number of providers that serve that area that really are challenged to find employees. So more to come on that. We're going to be working on figuring out really smart ways to advertise for this job fair. We definitely want to reach out to the junior colleges up there and make sure that they have the postings. So certainly once we get the flyers, we hope that you guys will also, post it on your social media. Again, when we do these events, we only open them up to regional center service providers. So again, we don't want you to have the competition from all the other, employers that are out there. All right. Thank you very much, Carly, for that, all your support with this project. For accounting, oh wait, let me check the chat real quick. If I miss anything. Yes, Carly does rock. All right, awesome. So from accounting, we are going to get an update to the ARM rates that are coming in, and that is going to be on the 23rd, and so they will be good to go for invoicing. Additionally, we learned that the ILS rates have been received and that the invoices are going to be created. I think she's doing it 3 days before the end of the month, so we can figure out the math for that. But all ILS agencies should not have an issue. We believe that we received all of the different rates. There should be time between when everything posts towards the end of the month. Obviously, you can reach out to your fiscal assistant and something looks like it's not correct or anything like that. But again, it was just a additional push forward. As it relates to rates, I have a message from our executive director that she sent to me this morning because she's at the ARCA board of directors meeting. I was at the ARCA executive directors meeting in the morning, which I can share a little bit more about that with you all, but she's at the executive directors meeting, excuse me, the board of directors meeting, and also met with Nancy Bargeman, the director of DDS. As it relates to the implementation of the rate study, I am directing all of my staff, and you will hear about this on Tuesday. We are to move forward as if the rate study is going to be fully implemented as it states currently in the language within the budget, meaning that the full implementation of the budget of the rate study will happen by the July 1 date. And so we know that there's currently a budget proposal, but as a reminder to folks, as it relates to budgets, this is the very beginning of the budget process. Your executive director, Lori, wanted me to pass on to all of our service providers that there will be ample opportunity for you to lend your voices as well to the topic. There will be opportunities to testify at hearings. There will be opportunities to write letters, and those are opportunities that we can talk about. My understanding is that the Association of Regional Center Agencies is going to come out in support of maintaining the rate study. Some of you are aware that the Association of Regional Center Agencies put out a budget position in August of 2023 that called for not only the implementation of the rate study, but that the rate study be allowed to contain opportunities to go up with inflation as well, and that it allowed to be recalculated to keep up with the hiring needs of our service providers. So I know they're talking about that right now. Maybe I'll just share my screen real quick. This is not recorded meeting, is it? I'm just joking. All right, so I'm going to share my screen real quickly. This just gives you an idea about the budget priorities for ARCA that were established in just a few months ago. Number one, near and dear to our heart, and we will touch on it just shortly, is prioritizing truly affordable housing for people with developmental disabilities and projects funded by the Department of Housing and Community Development. Update service provider rates based on inflation and needed rate model assumption fixes to better address service access needs, particularly in underserved communities, and fully fund regional centers for service coordination and commit to a revision of the core staffing formula. So again, as it relates to our staff and looking at the rate study implementation, we are still on track for supposed to be July 1 of 2024. That being said, in our service providers, I can provide you this update as well as we do every week. We have still not received the rate crosswalks from the state of California. The Department of Developmental Services has not let us know yet exactly if which service codes are going to be transferring to which service codes. There's still options that are out there that we need guidance from the department on, and we have been waiting since May for that guidance. Additionally, hey Shamir, I don't do a lot of questions from staff during the meetings. Sorry, we can talk about some of that stuff later though if you want to. So as it relates to the budget and the rate study and the implementation, we really need that information to do the last part of the rate study calculations. We need to figure out where to stick you guys exactly, and we need to be transparent with it. We're still told that the department's going to be holding individual meetings with different groups of service providers before finalizing this. We haven't even heard about those meetings being announced yet. And so again, that's our update. We don't have the updated information like right now at this time, but we certainly will look at providing it to you all as soon as it becomes available to us. One question vendors want to know is what is the final service code? And we've already had some individual meetings with you all that some of these service codes just don't seem like they're going to work for you all. And so anyways, that being said, let me pass. So that was the message. Yeah, Nancy gave the direction to operate as though the rate study implementation is going to happen on July 1. Regional centers need to prepare themselves and act as if. And that's the message that Lori wants passed along to all of you. And I don't believe that the ARCA budget position document has been shared widely yet. I probably by next week or so, I would assume that they're going to have it posted on their website. They think they're sharing it with their board of directors right now. So, but no surprise there. I think that they are going to come out in support of the vendors getting their full rate study implementation earlier. All right. Do I think the governor's proposal will be rejected and that the rate study will be funded? I will say it sounds like Lori wants to make sure that you all take opportunities to express your desires as it relates to that in public hearings and in letter writing and any opportunities that go on between now and then, Carly, or excuse me, Carol. Looking at Carly while I'm looking at Carol's thing there. All right. And was there there's a question about transportation. Yeah. So nothing. I will just say I believe that they are continuing to try to figure out what a rate kind of fix is going to be. That I believe everyone is dissatisfied with the transportation per trip rate calculations that are put forth in the rate study. However, I believe this is the situation that I'm in. Once July 1 rolls around and the rate study is fully implemented, I don't believe that we have the opportunity to offer anyone else any other types of rates other than that if they're a new service provider. And then if you're a continuing service provider, then you then fall into the hold harmless phase until 2026. And at that point, then you would no longer be able to have whatever, in essence, grandfathered in rates you had previously. That's still the way that we're looking at things. The question is just going to be whether or not they're going to allow the full implementation of the rate study in 2024 or whether it's going to happen in 2025 as the new governor's budget proposes. But again, we have the budget announced in January. We have hearings. We have the May revision that comes out and we have hearings. So there's going to be assembly, there's going to be Senate hearings, there's going to be lots of opportunities for people to give feedback. Our provider advisory committee meeting, I think, would probably be the best place to get if you want to be very interested in knowing about the advocacy at a statewide level, attending the provider advisory committee meetings, which do occur monthly between now and when the budget's done, you'll get good updates and maybe you guys can coalesce around some advocacy ideas as it relates to the rate study. Again, passing along that Lori really wants our service providers to take those opportunities. Any questions about that? Does anyone have any information? I don't know if Eric does or anyone else that's on the line that's a service provider that's part of any of the work groups with DDS, but has anyone reconvened anything as it relates to transportation? I don't know if R&D's heard.
No, the last series of emails with the department was with me was in November, and I had checked in December and I hadn't heard anything. But at that point, they had engaged formally with healthcare management or health management, aka Burns and Associates, and Stephen was running new models based on our recommendations. So we gave feedback on that. I gave a bunch of feedback, and as I understood, he was going to run new models based on what we proposed. And I don't know that it's, I'll share it more people want to know, but without going in all those details, we've asked for a follow-up, and I was hoping that work was going and we would see something in the budget, but it looks like the proposal to just delay the rate study, they didn't want to deal with also fixing it at the same time. So I actually am typing up an email right now to that group because I just, this conversation, I've been meaning to follow up with them. So I'm gonna poke them again and see, gosh, can we get any updates? Can we talk about it before we get too deep in the budget season to see if there's something that we can include in the budget. So I'm gonna keep my pressure on. If you can keep doing the same from your CSS groups, John.
I will tell you, I will certainly
for the
I
rate.
will certainly be following up with our community services directors about it when we meet next month at Alta, because I mean, I know, for example, that there's some regional centers that are looking at, you know, like a lift option for things like right now, like as like a direct contract with the regional centers. But like these are not how we're going to solve our transportation issues. Like the rate, like we need to be focusing our attention, I feel like, on that group that you have so that people can be really scoring out what is the cost going to be if we shift over to doing this methodology, and can we afford it, and what would the rollout look like, and like I don't know, these things, the methodology has been public for too long for us to be only this far into trying to fix it, I feel like.
Yeah, probably a lot of folks, the methodology was really convoluted, so it was really difficult for folks to understand and get feedback to fix the old methodology. That what we were told, but you know, things can change. What we were told was they wanted to get some draft models and options to DDS, and then they wanted to go out for public comment. But then it just seemed to stop. So yeah, we know that this can happen with the department sometimes, or I'll say this can happen with the department sometimes. You know, they'll engage, but there's not really a public avenue yet. So that's what we were told. If that comes up, I'd highly encourage folks that have an interest in transportation to be involved. And I will certainly like meet with you or provide technical assistance for you guys to get up to speed and know how to give comments. I'll give updates to the group. But right now we need to get this back. They're probably working in private and debating, you know, and or not working at all. So we need to get this going. So I'm gonna bug them again, and we're gonna try to get
Thank you.
update.
We live and die with transportation, folks. Like everyone that is in case management here knows exactly what I'm talking about. And so like not we're bringing on a ton of people. We talked about it last week. We brought on like 15 transportation providers, and that is amazing to bring on all these new providers. But it's even better to be able to maintain all the people that we have and give people a sense of like security in the businesses that they've been running for years. Like people have been running these businesses for years, and now we hear like, oh, we want to keep expanding these services, and we have to expand these services. And you have this uncertainty around what is the payments going to look like over the next few years for the service. And so it's like we're asking a whole lot of these folks to run businesses with that level of uncertainty when so much attention honestly has been placed on other service codes, and transportation is what makes it all work. Like so again, you're all very important to us, and I don't want to strike that down, but when clients can't get places because we don't have the transportation available, doesn't matter how amazing your day program is, it doesn't imagine how amazing all your services are if we can't get folks there. So please, Eric, if you can keep us updated on any changes in this meeting, or definitely during our provider advisory committee meeting, because and you know definitely want to keep our transportation providers all up to date on any changes. Hopefully there will be some. All right. Michelle, DSP stipend. Speaking of good news, we're transitioning to good news.
Yeah, let me share my screen really quick. I just wanted to update everyone on our current numbers. Okay, are you guys seeing the breakdown, John? Is it loading?
Yep.
Yes.
Okay,
We are.
perfect. Thank you. Yeah, so I just wanted to share, we're continuing to receive our reports and send out confirmation emails. So not a whole lot of update there. I just wanted to update everyone on our current numbers. So last time we reported, I believe we reported on the January 12th number, which was 37,000. So according to January 17th, it looks like we've gone up a little north of 1,100 for new DSPs that are registered, or total DSPs that are registered. So we're almost at that 39,000 mark. So continuing to grow there. And then regarding Alta, it shows that we had a 5.6% growth, which is totaling 241 additional trainings for DSPs. So our total is at 7,192. So we're continuing to grow. Thank you guys so much for continuing to share with your staff and having them attend these trainings.
I have a question.
Yeah, go ahead.
700 or 7,000 something 92. How does that rank compared to other regional centers?
Well, I'm glad you asked that question, Eric, because you guys are still well ahead of the other regional centers that are much larger than you and have many more service providers to advertise this to and to participate in. So again, I say we have the best trained DSPs in the state of California at Alta California Regional Center, providing services to all of our clients. There's not a whole lot of other measures out there that let us know how well the folks are trained. And so again, the fact that we still continue to have a high percentage of new people that are joining, it also speaks to you guys, because there's only a finite number of DSPs that serve our clients. There's just way more than you think there is. Like, there are tens of thousands of DSPs that are serving our clients amongst the 1,000 or so of you that bill us every single month for services for our 30,000 plus clients. And so that means that there are certainly more folks that can participate in the DSP stipend training, and we want everyone to get this opportunity to get money that they wouldn't otherwise get for doing training, and we want you all as providers to get the best trained staff possible. So I cannot be more impressed with how you guys have gotten this out to all of your staff.
And to answer that, John, Alta Regional is the highest in DSP trainings, and below that, we're above about 890 DSPs.
And again, the regional centers that trail us are ones that are, much larger than us as well. And so that's, again, we're getting good utilization of this benefit. And I will mention at the same time as well, we had a presentation at our provider advisory committee meeting last week, and I thought it was great from Vicki Smith, and she went over those workforce initiatives. But it does take a lot as a regional center to be the regional center that pilots all of DDS's programs. And so the fact that we are doing the with Rhonda's project, with the workforce assistive technology, with the DSP university, with the which was one that's coming up for us as well, and for the DSP internships, again, and then look at the utilization for the DSP stipend. And I've got the numbers here for, what's my next one I got? My next one I have is DSP, my next one, if I can open it up on my computer, is for the DSP workforce. And I'm going to share my screen real quickly. Again, just another example of service providers of ours. So Gaspar Care Home, I see Lafay Youssef, Quinley, Shipley's. We had Chuck Shipley was on here starting our meeting last time. Let's see, Sierra Brook, which is Milieu Center. So again, these are the people that filled out the DSP stipends, filled out the DSP surveys and are getting their new run of $8,000. So again, you guys are taking advantage of all of these DSP initiatives and making sure that people are trained. You are providing the data to the department. We are doing really well as far as participation in that too. So again, I just can't encourage you all enough to continue to do these things, because you guys are very well connected to all of these activities and are performing, and it again does nothing but benefits our clients in the long run to have these better trained staff, better systems for our service providers. All right, so ILS rate increases, yes, I mentioned, I believe that those are going to be good to go for your billing for next month, so no issues there. I am going to throw it over to Scott. Scott, are you going to need to share your screen at all?
I do have the memo.
Okay,
if you
let
wanna
me
share that.
make you a co-host. The real Scott Barr. There it is.
All right, is it sharing?
Yes.
All right. So I have the pleasure of talking today about the Home and Community-Based Services final rule. As many of you know, we're conducting our on-site visits, and we've been communicating that out to providers a month prior to the visits actually happening. And this next step is from a memo that was released on January 8th in regards to reporting monitoring activities and compliance data to the department as referenced in the directive from December 1st of 2023. And so this directive defines the data that we're going to be reporting, and it helps us to also come up with a method for reporting. And I think we'll probably engage in the SharePoint side of things. And then so the required data that we will be asked to present are the number of settings reviewed on site since March 18th, 2023, the number of each CBS compliance settings upon initial site review, the number of settings with an HCBS corrective action plan. Let me scroll down a little bit here so you can see where I'm at. Or a CAP in progress. The fourth one here is number of settings in remediation with technical assistance. The number of HCBS compliance settings after remediation is complete, and the number of settings currently appealing the on-site HCBS review findings. Lastly, then the number of settings that have been issued sanctions in accordance with the December 1st, 2023 directive. So the regional center has to start to report these by January 31st. And again, there's two options that have been presented to us. And this is really just about making sure that we're being transparent with you as to what the requirements are, the milestones and such for CMS. I think that's all I've got.
Cool. Any questions for Scott? Thank you very much, Scott. Again, for HCBS, we are, hitting hard on those reviews. Regional centers are certainly under the time frame of getting everything done by August for folks, but none of this should be a surprise to people. Every single provider has been given the information up front, and every new provider doesn't need to worry about it because you were vendored with all of this done already. So, we will keep you updated on our status, and now we've got, a whole unit over there that is going to be focusing on a lot of these quality assurance activities. All right. Let's see. In the chat, I forgot to add something regarding advocacy for the state. This is from Michelle Ramirez. For the state budget, both CDSA, California Disability Services Association, and CCLN, the California Community Living Network, will be aggressively speaking against a rate study delay, I would assume. As advocacy directions come through, we will be passing on to all of you. And so they do give those updates, as I mentioned again in our provider advisory committee meetings. There's updates from all of the different advocacy groups, and it's always fun around budget time because sometimes you can find out about when hearings are during those meetings and even get opportunities if you want to provide testimony for those hearings. I've had the opportunity to do that during the budget time frame, and it's a great way for them to hear directly from people in the system about the impact of the law changes that they are looking at doing. All right. I want to continue in my sharing of good news and go over to our approved community placement plan for 2024. I'm going to make this as large as I can, so hopefully it's somewhat easy to read on this big screen. Just keep making it larger and larger. All right, cool. This should work. All right, I'm going to share my screen. Hopefully folks can see this. I don't think Jordan made it back from her other meeting yet, so I'm going to roll through it. We just got this great news from the Department of Developmental Services. And let's see here, 1 second. Just verify. Oh. All right, are you guys seeing my shared screen okay?
Yes.
I need someone to respond because I can't see you guys anymore. Where'd you go? Oh, there you
Yeah,
are. Now you're
John,
back.
we can see it.
New laptop, love it. Okay. So I'm going to go through this real quickly. So we got first and foremost, at the beginning of this year, we were told by the state that they were going to approve one of our housing projects that we had requested up in the Grass Valley area. Unfortunately, during the course of this year, we learned that due to some of the insurance costs and the development of the project, that it was not going to be able to move forward. And Rhonda worked really quickly. She's our housing specialist. And we had some discussions with the Chelsea Housing Corporation. And so unfortunately, we lost that project that was going to be in the Grass Valley area for 12 units, but instead, for the same amount of money, we were able to get 15 units in Sacramento County. One of the challenges in developing affordable housing is that not all counties develop affordable housing at the same rate. Like in Placer County, there's very little affordable housing being developed as opposed to in Sacramento County. So unfortunately, sometimes we do have to look at projects in Sacramento because those are the ones that are most ready to go. And in this case, we had to switch the one from up in the foothills and move it down to Sacramento to be able to get an awarded project. The department did award that project. That will be 15 more units of affordable housing for people with developmental disabilities with Chelsea Housing Corporation. Additionally, the department funded the regional center for $425,000. This was a contract that we did on behalf of DDS so that they could acquire some land next to a state-run facility, and they can't do direct contracting, so we had to get involved in it. So we did that for them. The next one is a 10-unit project in Sacramento with Mercy Housing. We've been writing letters of support for this Mercy Housing project for the last 3 years for different types of funding that they've been trying to get. And they finally got ready, and we finally got ready to be able to put in a request to the Department of Developmental Services. So this is for 10 units of affordable housing off of a development that they are doing in Sacramento. I'll be doing a board presentation. I'll be doing where am I going to be tomorrow? I'm going to be at South Area People First presenting about housing on tomorrow. And then on Tuesday, I'll be at the Olmsted committee, the Department of Health and Human Services, Olmsted, whatever, I don't know the new name of it, but Marty Emoto is having me talk about housing stuff there too. So for I think some service providers attend that one as well, the Olmsted group. But this is a multifamily housing project. We're very excited about this. Again, these will be homes that our clients can move into. Once they move into these homes, they'll be able to only have to pay 1/3 of their income, which will be the cost of their rent and their utilities for those homes. Our clients have housing choice vouchers by and large, and so they'll be able to use their vouchers at the project-based units that are in this housing development. And Mercy Housing is a huge developer, really big in our area as well. And so being able to get into a project with them is very exciting for our regional center too. So these projects, varying timeframes, we'll get updates from Rhonda probably in the future on when people are going to start construction and do some of those other things. But right now we're just working on getting into contract with them. So congratulations, Alta. We've got 2 more new housing projects for multifamily housing. All right. Additionally, we had a request for a new enhanced behavioral support home. And this is an enhanced behavioral support home to help support individuals coming out of hospitals. Oh, apropos, something that we certainly need is many of us have to leave this meeting maybe a little bit early to go do a hospital meeting at 12. We got money for that. We also got money, as we have heard loud and clear from our community, about building services to support our aging clients. We also got money to do some startup funds for an RCFE for clients who require nursing oversight and support. We also got funding to do a RFP for an FMS. I will share with you statewide, all the regional centers are maybe looking at a combined FMS RFP. We need more FMSs. I think we got good news that we're in the process of becoming a user regional center of a brand new FMS out of Westside Regional Center. And so that one should be processed here in the very near future. We've already let our self-determination staff know. But again, if you're on the case management side of things, certainly impacts us at, community services, and certainly impacts you as vendors as well. The FMSs and all the delays that are related to it, the delays in being able to implement new FMS budgets, it really is impacting us at the same time that we are trying to promote things like CIE and the paid internship programs and SDP, and all of these things require FMSs. The participant directed services, they all require FMSs to be able to do what's needed. So we're working on some statewide solutions and hopefully with some more local solutions as well for bringing on an FMS. Additionally, an after hours center based out of home respite for up to 10 children at a time. And I don't know, Helen Neary, are you able to kind of explain why this isn't? I saw Beverly nod her head as we were talking about it, but are you able to explain a little bit about why the service like this might be something that our families and clients would appreciate? You have to unmute yourself, otherwise they can't hear you though.
Oh, okay. Yeah,
There you go.
so that a center-based respite was specifically requested by our Hispanic and Russian families. And the idea is it's a day respite facility where it's more than just respite. There's actually going to be activities that the clients will be engaged in, whether it's socialization or learning how to cook or drawing. The families requested that their children not sit at home, watch TV with the respite worker. So the day respite facility, we're hoping that will accomplish the request of the multicultural families. So, John, I
That
think
was the condition. I believe that's the condition that DDS put on it, is that it has to be bilingual. And so awesome. I appreciate, again, this is a little bit of out of the box thinking for a CPP CRDP plan, not maybe something that we've done, but again, if you work on the children's side of things, like you might recognize planning teams that would really appreciate something like this, right? And for you service providers, I know we're a little heavy on adult service providers that come to Coffee with Community Services, but for any of you that work with children, being able to provide some of these respite opportunities for folks are really key. So thank you for getting that in the plan, guys. Funding for a new vendor psychiatrist to get specialized training in serving IDD clients that have co-occurring mental health disorders. Right now, we only have one, and we certainly need more. Otherwise, we will have none, right? And so we're going to do some startup funding for that. It's been a while since we've done outpatient substance use disorder treatment for consumers with developmental disabilities. We had a approval last year for the substance use disorder home. And so it sounds like this might be a great complement to the substance use disorder home, having some good enhanced outpatient services. We built our partnership with Strategies for Change before they got gobbled up by the effort, or what are they, WellSpace now? WellSpace? Before they got gobbled up by them, but and MAP too, right? When we used to work with MAP as well. But it would be good if we can get, some more folks to be able to provide this specialized assistance for our clients. So very near to dear in my heart. Some of you vendors from a long time ago might remember me doing all my drug and alcohol trainings for Alta. And so it's cool that we're going to look at trying to get some services that can really support people. And again, speaking of that, housing access services for clients primarily living in outlying areas. We want to work really creatively with someone that wants to expand housing access services. This is both helping people find homes and being able to retain their homes. Working on, helping people be able to utilize their affordable housing vouchers, really working closely with the local housing authorities and looking at what opportunities are available for clients. And for us, I'm interested in also looking at financially how to make it work when you have to travel distances to be able to support clients as well that are doing this. So we have an RFP that's going out for this service as well, looking at trying to get supports in areas like Grass Valley, Tahoe, Yuba City, etc. Additionally, we got enhanced deflection SLS services for either community-based or deflection-based clients that benefit from independent and or unlicensed living environment due to their complex support needs. So this is RFP funds to support specialized training to a newer existing SLS vendor to train and recruit staff with extensive experience supporting individuals with IDD and complex support needs. So for my staff, I want to verify that would be an RFP that's open up both to an existing enhanced supported living provider that is looking to expand their services, or to a new provider that wants to get vendored for enhanced supported living, which has no real regulations other than what we've put in kind of our standards. And wants to ensure that their staff get trained in order to do it, because we have found the intensity of trying to serve some of the individuals in enhanced supportive living that otherwise have been institutionalized or in prisons and jails for a lot of their life can certainly require a technical level of skill that is well above what you would get for an entry level DSP. And so we as a regional center, though we do support growth on the residential side of things, we are huge proponents here at the regional center of serving people in the absolutely least restrictive environment possible. Supportive living on the spectrum of those environments can be extremely restrictive, and it can be not really restrictive. But when we do have these restrictive things that do go on in a setting like supported living, where we don't have community care licensing providing oversight, where we don't have the strength of some of the regulations that are required, it really requires our staff to be very good about the monitoring, to be very good about making sure that all of those support needs can be met with, you know, the budget that's been developed by the agencies. So it takes a lot to be able to do it well. It is a hard service to do, but we are committed that we're not just going to build new homes for people. We want to, you know, care homes for people and institutional settings for people, but more settings for people to be able to live independently. That's what our community has asked for. It's just trying to do it in the safest way possible for people. And finally, the last thing we have here is they approved us for some additional funding for one of our homes that is opening up. I think Bellport's opening up pretty shortly, right? Like in the next 2 months. I believe that's an EBSH that's opening
Yeah,
in
that's
2
the
months.
goal.
And so looks like they approved us a little more funding. We did ask for some of those specialized day programming type of things. We didn't say whether it was going to be center-based or community-based, but it was supposed to specialize in the outlying areas. I see that the department did not fund us for those requests. We put out a lot of requests out there. I'll be very honest. This year, a lot of different types of requests. I'm very pleased with what they did approve. But you know, the reality is that, you know, there's $28 million to spread out amongst 21 regional centers when it comes to funding. And so there's just not enough, you know, for all of these types of requests. But I'm very pleased with that. We've got we'll have an internal meeting in the next week or so, I think, and then we will be sending out for our RFP orientation, our bidders conference, basically, that the regional center will do. Are we doing these hybrid? Are we doing it in person? What are we doing, Heather? Do we know? Or
I think we
Christy?
talked about hybrid.
Okay. I like having people be able to come in person. So I'm totally willing to have you guys do it hybrid. But I'll pop in down there as well. I think of when we did it for Sonoma Developmental Center, and some of you guys were there. We had like 100 people there for the RFP orientation because we had 27 different projects that we were planning on doing. It was crazy to see. So this is the most. Jordan was blown away about the number of projects that DDS approved this year. I think Rhonda's very pleased to find out that our housing projects. Were you able to connect with Mercy Housing, Rhonda? Were they have they been informed? Are they pleased?
Yeah, they're thrilled, and we have a meeting scheduled, Dan and I, with them on Wednesday for next steps and get the paperwork rolling.
All right. Last, thank you very much for that. That's awesome. Last thing, I don't take some time if you can, hop into Alta's events calendar, hop into DDS's events calendar. I just want to talk to you about one thing real quickly. And I think I saw Herman. Maybe he's still on here, but heads up, Herman. So Lori and I were messaging this morning as well about an idea that she had in relation to the micro enterprise fair. So we had 3 beautiful baskets that were dropped off in Lori's office from one of the people that was a participant in our micro enterprise fair. What we would like to do, and I'll figure out how we're going to reach out to you all about this, but we'd like it if you could connect and provide us information about people that might be selling things for Valentine's Day. So if you have a client that you support that might have something that, like, I think we think of Matt that does like those hot chocolate bombs, right? We see him come out all the time. Like, we'd like to focus over the next couple 2-3 weeks in our social media, and then also promote it to our staff internally at Alta as well, if they want to buy things from any of our clients between now and Valentine's Day. So that's the message from Lori. We'll put out something probably in writing to you next week about that, but if you can start thinking possibly of anyone that you would be interested in doing that, I'll have you we'll have you send that into Zach Horch. That sounds like a great way to do that for those that are on here. So Zach will drop his email in the box for those of you who are not familiar with my executive assistant's email address. And if you have someone that you'd like us to feature, we would look at what their price list is, please. Pictures, we'd like pictures of what they are selling. And we'd like to be able to promote that on our social media for the next few weeks. All right. And again, I know some of the staff that have the 12 o'clock need to pop off for that one. Anyone, Carol Wattillo, yeah, please.
Hi, I just wanted to, we did our first HCBS training yesterday. And we had, I don't know the exact number, but about 40 people attend. People shared that they thought the information was good. They really appreciated the resources. And I just wanted to shout out to Alicia and Kylie. Thank you so much for helping organize and get all of that connected, and for your hard work on that as well. We appreciate that, and look forward to the next one, which is next Tuesday.
Did you say 40?
Yeah, I think so.
Wow. So again, I want to, I guess, reiterate this whole thing about me just being very pleased with you all as service providers, that you're even taking advantage of these types of training opportunities for HCBS compliance as well that's being offered to you all. So I don't know. I'm just very impressed with you guys, because this is what the hope is that you guys can communicate, assist each other. Carol's got a lot of experience in this stuff. And so that's awesome. Lindsay?
Well, and it was mainly residential providers, and they really were eager also to be able to include their other staff and ask us if we could record it. So record the training so that they could then share if they had staff that couldn't also come. So we're going to try to figure out how to do that. Although I hate that, but we'll try to figure out.
Looks like, Lindsay, you dropped a survey for us in the chat.
It's actually not a survey. Futures Explored has a new resource that's available for anyone to use, but we're specifically marketing it to the IDD community. It's our Huddle Lab, and it's essentially a computer lab with a lot of really cool assistive technology in there. We have adaptive mice, we have switches, we have tilting desks for people who use wheelchairs. We have screen magnifiers, we have video conferencing equipment, we have Wi-Fi. So, it says I'll work on that survey.
Yeah, I couldn't get it to open.
Okay, thanks for that feedback. So if you need to have a meeting, if you need to have a class or a workshop, if you just want to bring a crew to use a computer lab or watch a movie or play video games, keep this in mind. I'll also put a flyer in the chat. We're in Midtown on 26th and R. We're super accessible to public transit. Between 8 and 4, it's free to use. Monday through Friday, 8 to 4, it's free. Outside of those hours, there's a small fee so that we can pay to have a staff in the building.
It's a very cool space. All right, so we're gonna get that flyer out also in the, for the new FMS, can we just follow up next week and verify on Coffee with Community Services if it's done already? And then, I mean, obviously, we're gonna get it out to all of our service coordinators. Nice to get them heads up sometimes before our vendors, but yeah, let's do that. And then, but I think we have another one coming down the pike as well that is getting vendored from another regional center that is getting sent to us. So we're working it out so that the regional centers just put all the FMS information in one location, and then we just each pull the information from a shared drive. So make it a little bit easier to share these commonly used vendors, and we certainly need more FMSs. So, all right, I think that is what we have for today. Thank you all very much for joining us, and more to come next week. Take care, folks. Great weekend.